Have you ever wanted to understand exactly how a dental implant is placed but were afraid to ask? Today I'm going to show you, in a simple step-by-step way, how this procedure that can transform a smile actually works. I'm Dr. Alessandro Barbosa, a dental implant specialist with over 20 years of experience, and I'll show you what really happens, from the initial assessment to the final result, straight to the point. By the end, you'll understand why the implant is safe, predictable, and comfortable. Step 1. Assessment and planning. It all starts with a detailed consultation to understand what the patient is looking for. During this consultation, we take a panoramic X-ray for a general assessment and, if necessary, a CT scan. With the CT scan, we can assess the bone, the position of nerves, and the maxillary sinuses. At this stage, we discuss expectations and determine the ideal type of implant for the case. Planning is the secret to success. This is how we avoid surprises and ensure predictability. Using an intraoral scanner, we scan the patient's dental arches. Then, with the help of software, we can merge the bone image from the CT scan with the image of the teeth and gums captured by the scanner. From this three-dimensional reconstruction, we determine the exact position we want for our implant. Once the position is set, we'll create a surgical guide. This ensures that the planned position is perfectly replicated during the actual surgery. With proper planning and the surgical guide ready, placing the implant is certainly a simpler, faster, and more comfortable procedure for the patient. The surgery itself is relatively quick and simple. The dentist makes a small opening in the gum and bone to place the titanium implant. Thanks to anesthesia, the procedure is virtually painless. The implant's stability is checked immediately to ensure it will integrate properly with the bone. The initial stability of the implant is one of the factors that can influence its success. After the surgery, a process called osseointegration begins. This is where the bone heals around the implant, fusing strongly to its surface. This takes anywhere from 21 days to 6 months, depending on the type of implant used, its surface treatment, the bone quality, and other factors. During this period, the implant remains protected, and you can use a temporary prosthesis if needed. It's at this stage that many patients are surprised by the minimal discomfort thanks to modern techniques that are minimally invasive. After osseointegration, it's time to place the final prosthesis. It can be a single unit, a crown on an implant, or fixed over multiple implants in cases of partial or even total tooth loss. In the case of a full arch, we call this a protocol. Here, the aesthetics are planned to fit perfectly with your natural smile. The implant, just like a natural tooth, needs proper hygiene and periodic checkups. Proper brushing, the use of specific dental floss, and regular appointments ensure that your implant will last for decades, often for a lifetime. And that's the step-by-step process for a dental implant. Assessment, necessary exams, careful planning, the creation of the surgical guide, healing, placement of the implant prosthesis, and maintenance are all important steps. The method I described for placing implants, performing a guided surgery, is an excellent approach. It's safe, fast, and provides predictable results. If this video helped you, leave a like and share it with someone who needs implant treatment. This could be the first step to changing that person's life. And if you want to keep learning more about implant dentistry and oral health, subscribe to the channel and activate the notification bell so you don't miss any new content. I'm Dr. Alessandro Barbosa, and my mission is to demystify dentistry and help you make decisions with confidence and information. See you in the next video.